I think it speaks volumes to be a healthcare system and not guarantee your own employees healthcare.
We're being told one thing, that it's fine, you can receive care through Providence, you're covered, but when we call the insurance company, they're saying no, there's no contract reach, you're not covered. Like, most of us cannot afford to just forge forward and see where the bill goes.
Oh, our benefits are horrific. I unfortunately have a immunocompromised husband who suffered a serious brain disease called Tay-Sachs syndrome this past 2 years, which put him on long-term disability. Our deductibles are through the roof. Our out-of-pocket max are unrealistic.
These are the people that work alongside us, and now we don't have easy access to them.
We take care of the patients. It's a CEO's job to take care of the employees.
I would encourage the higher-ups at Providence to come back to the table, and instead of paying replacement workers millions of dollars over the next week or 2 weeks or whatever it is, come back and get your heart back inside.
Another one of those sad cases where people who are working in the healthcare industry can't even afford to be seen at the same hospital that they work at. What are we doing? What are we doing? What are we doing? Again, I've been saying this and I'm going to continue saying it. We've got to find a happy medium. Because if the people who are if the people who are caring for people are worried about their own health care and the health care of their families, how can they truly provide the best care for everyone else? That's all I'm saying. We've got to make a better system. It's got to be better. We've got to come together and figure this out. Again, if you have suggestions or things that we can do, things that I can do personally, let me know. Because if we can't figure this out, where do we go from here? What does it look like? We already have a shortage of nurses. It's a huge shortage. In Georgia, we have a shortage of doctors because the insurance is too high. So many other factors are playing into it. You have hundreds of thousands of people in Georgia who have to drive over an hour just to see a doctor. It's not an opinion, it's a fact. It's not an opinion, it's a fact. Why do we expect them to continue to do this job and worry about the health care of their own families? Make it make sense. Henry Mason Jr., Healthcare Henry is what they call me sometimes, but let me know what we can do to help. And for more healthcare tips, you know where to find me.